Hello, my name is Dr. MarkAlain Dery, and I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. Now, you've seen me do these updates now for almost a year, and in conjunction with the leadership of the ACOI. Hello, leadership at ACOI. Thank you for letting me do these. I hope these messages are helping you keep up with the latest on COVID-19. I know that many of you are in the thick of the fight, and I'd like to thank you on behalf of all of us who focus on infectious diseases daily for a living, and certainly on behalf of the ACOI. Hello, ACOI. So moving forward, and together with the ACOI, we will continue to share information as it becomes available, as well as the hopeful progress that we are seeing as well. All right, so let's get on to our first topic of conversation. It used to be, and if you get this reference when I say pork chops and applesauce, right? Pork chops and applesauce. That is a pop culture reference that dates me, and probably if you know that reference, it probably dates you too. But the new version of pork chops and applesauce is what I hear all the time, which is vaccines and variants. So we have variants on our minds. So let's talk about vaccines and variants. Now, the COVID buzz within the medical community, as I'm sure you're not surprised to hear, are variants. The big question is, will vaccines protect against variants? And what about all of those who have natural antibodies from being previously infected? What's going to happen with those folks? And what we do know is that variants do escape natural immunity. That's just the truth. I already know a couple people, you probably do too, who had COVID in the spring or summer and now have COVID again, and they very likely do have variants. They both live in areas where variants are prevalent. So you can be reinfected, which I want you to know this so that this way you can also tell and remind your patients and your parents, but your patients of that fact. I have to remind my parents regularly. They live in Idaho, and masking is unfortunately not the best in Idaho. So it's important for those who've been previously infected with COVID-19 to remain vigilant, masked, double masked. Do I triple mask? Maybe I've triple masked maybe once or twice, possibly. But also remaining distant. So the big question is whether variants escape vaccine-induced immunity. That's the most probably cutting-edge question right now. Can variants, do they evade vaccine-induced immunity? There is a study. I will get to it in a moment. It's not great news, but we will take these little tidbits one step at a time. We are science-based. But it, of course, has captured the world's attention and is the number one thing, I would say, that labs around the world are currently working on. So the good news, the vaccines are working, and they are helping to eliminate hospitalizations and death. But the feared variant, which is the B1351, that emerged from South Africa and that's because of the mutation that it picked up along the way called the E484K. Some people refer to it as the EEK mutation, is compromising vaccine efficiency. The explanation of this is likely because of the way the virus is evolving. That E484K mutation in that study I mentioned a moment ago that looked at variants, and they studied pseudoviruses. So this was benchtop research essentially. These were viruses that were created to emulate these variant viruses, and what they found was that with vaccine-induced immunity, and they looked specifically at mRNA vaccine-induced immunity, so they took young people roughly in their early 30s, they took their serum, so they all had gotten either Pfizer or Moderna. They had been either vaccinated once or had gotten the complete series with 2 vaccines, and they found that there was a significant deneutralization of neutralizing antibodies. In other words, there was an escape with a whole bevy of variants. But the one that had the greatest deneutralizing capabilities of the neutralizing antibodies was B1351. So it was able to deneutralize and escape immunity by 81-fold. So that's a thing. That's something that we're watching. So both Johnson & Johnson and Novavax vaccine, I don't know why we're not talking more about Novavax. It had a 90% efficacy in the US. But anyway, Novavax vaccine dropped, their efficacy rate dropped in South Africa during clinical trials due to the new variant. There will come a time when the majority of the susceptible population is vaccinated. Please, we need to get to that point. And the variant becomes better suited to survive and invade the immune systems of those who are vaccinated. We don't want to come to that point, though. This is worrisome because the variant could actually abolish the beneficial effects of broad immunization program. That's the case. And this is definitely something that we don't want to hear. Now, it doesn't help that the global vaccine rollout has been at a turtle's pace, and that has been especially true for those in low and middle income countries. Take a look at the maps of the world who've been vaccinated. No surprise, they have been resource-rich countries. Look at Africa. I think there's probably 4 or 5 countries in Africa that now are vaccinating. So even in the US, where vaccinations aren't as prevalent in the Deep South, this is where I live in New Orleans, thankfully Louisiana's been doing a great job, but our states that are all around us unfortunately have not. The variants are very likely to emerge in some of those less vaccinated regions, which increases the risk of new outbreaks, obviously, everywhere. So I've been asked, so, dude, what's the big deal? Don't viruses mutate all the time? So yes, of course, the answer is yes. The SARS-CoV-2 virus is mutating. It was mutating all last year. It mutates all the time, but it got really serious in mid-December when the more contagious and likely more deadly variant known as B117 was discovered in Britain. This happened just as the first COVID-19 vaccines started to roll out. Since then, several new variants have surfaced, and they have surfaced in dozens of countries around the world, becoming the dominant strain in some, certainly in the UK. Now, and we will start to see B117 here in the US. This will be the dominant strain here very, very soon. Just today, as of today's recording, the estimates are anywhere between 25 to 30% of B117 is the dominant strain. The CDC predicts this will likely be the dominant strain by the end of March. Now, let's talk about B1351, which emerged out of South Africa. Again, this has the E484K mutation, and again, it's difficult to immunize. Now, there is another one that has emerged out of Brazil that is known as P1. This too also has the E484K mutation, also responsible not only for reinfections, but also could also deneutralize, or it very likely deneutralizes antibodies as well. And then, of course, last week we talked about 2 new variants that have emerged in the US, both in New York and in California. And then I am very happy to say that in my state of Louisiana, we have seen a new variant, a 677, that as well as one that is emerging out of New Mexico as well. So the problem is that there's simply not enough genetic sequencing of SARS-CoV-2 going on to help prepare the world for new variants that are sure to come along, which means the chances are higher that they will continue to pop up and spread undetected. Now, as painful as this is for me to say, we are, after all, people of science, and we just need to recognize that the US is ranked anywhere between 37 to 40 in the world in terms of being able to do genetic sequencing. Not being able to do it, but being able, or just performing genetic sequencing, and we have to do better. So how can seemingly minor mutation change the virus's susceptibility to a vaccine? It's because our own immune system responds to the vaccine by producing targeted antibodies that can stick to a specific pathogen. In this case, the spike protein, which is, of course, the hallmark of the SARS-CoV-2 virus. That's spike proteins that stick all off the virus. Now, it looks like the antibodies that prevent the pathogen from causing an infection are beginning to not be able to quite do the job that compared to the wild-type virus. So studies are showing that vaccines developed by Pfizer and BioNTech and AstraZeneca lead to a lower concentration of neutralizing antibodies to B1351 than, again, to the older versions of the virus, the wild type. But since the vaccine generates such a high level of neutralizing antibodies to begin with, the reduced protection is still pretty good. It still works. But antibodies are also just one thing to talk about when we talk about how the immune system works. Immunity, of course, is generated by T cells in response to a COVID-19 vaccine that's just as potent against the new variants. Now, in South Africa, the AstraZeneca vaccine was taken out of commission as it was found to be less effective than the Pfizer as well as the Johnson & Johnson vaccine against the new variant. Now, another question is, do vaccines actually block the virus in its track, making the virus less transmissible? The problem is finding out the problem is finding that out is that this is an expensive and time-consuming thing to prove. But a study in the UK reported that a full course of the Pfizer vaccine did reduce the chances of developing a transmissible infection by 86%. In other words, they tested people, they looked at asymptomatic healthcare workers, and what they found was when they vaccinated them, and then they tested them repeatedly every couple days, right? And what they found was that there was a decrease, a burden of colonization of a vaccine, a virus in their nasopharynx and their oropharynx. So it was amazing. So another study, so that means that you're less likely to be colonized, less likely to transmit virus. So that's great. Now, another study looked at COVID-19 vaccines in Israel, and they reported a 90% drop in transmissible infections. These vaccines are amazing. They're doing an incredible job. Now, one advantage of the new mRNA vaccines is that the mRNA molecule delivers instructions to the body to make a spike protein found on the SARS-CoV-2 virus. And by doing that, it actually is educating the immune system to fend off the actual virus when it encounters it in the future. This is amazing technology. Be on the lookout for animation, because I got a grant that's going to animate all of this really beautifully. So more information on that later. So this means essentially, because this is a code of instructions that are on mRNA, manufacturers can easily tweak that mRNA to respond effectively to variants. The downside is that it's never that easy. It means changing the formula, the manufacturing process, and of course, there'll be times and delays in getting them out to distribution. So Pfizer is considering another tactic that would require a third booster, which could raise the antibody response 10 times. I'm a little skeptical about that. I'd like to see that. I've read it. I've not seen the data on that. Moderna, and that's largely because when you look at people who've been previously vaccinated, they have natural immunity, so they have antibodies. They get a first dose of a vaccine, their antibodies go up. They get a second dose of a vaccine, their antibodies do not move. So what they're saying now is that with a third dose of a vaccine that they get higher. I want to see that. Okay, anyway, so Moderna and Johnson & Johnson are continuing to study their vaccines in response to the variants, and more is yet to be determined. So don't tell your patients to wait for the perfectly formulated vaccine that is effective against every variant. Instead, the advice is to take the shot when you can. So when your turn is up, get vaccinated. So what does all this mean for the future? It means that there will be more variants, and we'll need to continue to be on the lookout for additional studies and continue to recommend vigilance to our patients. Masking, social distancing, and hand washing are still the main pillars here. So when you consider that these public health practices have nearly wiped out flu this season, they are certainly worth doing in the near future as we continue to move around this pandemic. And lastly, let me say that a rising tide lifts all boats, and that rising tide needs to be vaccines. And when I look at maps of the world every day, and I look at vaccination rates, and I see resource poor or middle-income countries that are not yet vaccinating, those are the places right there that more variants are going to emerge. So we really do need to recognize that we all need to work together, unified as a global team, so that we can once and for all get through this COVID pandemic, and so that we don't find ourselves in COVID-21 or COVID-22 or COVID-24 or what have you. We need to see COVID in the rearview mirror. Okay, so stay on the lookout for regular updates and to read more about the sources used in this report. You'll find them down. No, you won't find them down there. Maybe you will. So go to acoi.org/COVID-19. Together with the ACOI, hello ACOI, we'll help you have the latest information to help you respond to your patients and stay on top of this crisis. As always, feel free to reach out to me. I love hearing from y'all. MADery@mac.com. Please stay safe. We can do this together.